Hi, my name's Cody Kane. I'm the Physiotherapy and Day Services Manager here at Wolper. So I guess in my role I look after all the rehabilitation patients as well as our community patients that come in to do our Move Well classes. With COVID-19 at the moment, we have a lot more people exercising, getting out and about. And I guess we get a lot of common questions here regarding exercise and starting exercise and what to do with exercise. So I wanted to share just some common traps that people fall into and give some just general advice to try and help people out there. I think the first key thing is just consistency. A lot of people get motivation to exercise, something's happened to them or they want to prevent certain things. And when you start to exercise, we need to look at the consistency of it. So with that, we're talking about how often during the week, how long you're going for. The common trap that people tend to fall into is they just go too hard too early. So they get the motivation to exercise, all of a sudden they want to do 5 days a week, they want to do an hour at a time, and their body's not used to this. What happens in that case is generally people can maintain that for a week or 2 weeks or 3 weeks, but then the problem is they then stop. Then it's hard again to find the motivation to continue after that. So we generally just encourage people to find something that they're happy to do and they're comfortable to do, and then with that just doing short periods that they can manage, because doing exercise once or twice a week for 10 minutes, 20 minutes, when you multiply that out over a year, that's a lot of exercise, versus 3 days a week for 3 weeks and then stopping for 6 months. The other thing I think that a lot of people do is they get used to doing the same thing. So people might walk every day, but they walk the same path in the same period of time. And what our bodies do is we're inherently lazy. So our body will find the easiest, most efficient way to do something. So if you continue to do the same exercise over and over, you're not going to get the added benefit after a period of time. So from my point of view, I think just challenging yourself, whether it's walking a little bit further, that might be 1 or 2 minutes, that could be walking up a hill, walking up some stairs, it could be pushing a weight that's a bit more, doing a few more repetitions. And it's not every session you have to do this, it's just remembering that your body likes to be challenged, and any way you can do that is always going to be beneficial. So hopefully those couple little tips can help people out. I guess some other points to kind of consider as well are sleep and recovery. I think sleep's one thing that people often underestimate, in terms of if you're trying to exercise and you're not sleeping well, to then try and exert yourself or do exercise is really challenging. So sometimes it's actually better to have a decent night's sleep or prioritise sleep over exercise. And I think also in terms of recovery, your body needs a chance to recover. You can't just push it all the time. And whether that's eating a little bit better, whether that's resting more, whether that's stretching, whatever it is, there's always that side of things as well. You can't just keep pushing your body over and over, because then you're going to get to the point where you're going to cause injury. And then if you have injury, that will potentially mean you have to back your exercise away, which can then affect your motivation, which then also plays into consistency. So it's always using common sense is probably a big thing we tell a lot of patients as well. So common sense surrounding all of those things is really beneficial, and hopefully if you are smart about what you're doing, you'll be consistent for a longer period of time, and then you'll be happier and healthier because of that.